So what we're actually working on is a way to go down below the minimum temperature for ice formation, which is at minus 130 degrees Celsius. So down here, what happens is that water goes through a 13 log unit increase in its viscosity. So literally the water molecules themselves can't rotate to form a crystal. They get jammed into a glass instead. So it's glass and not ice. Here, you can actually be stored perpetually because there's no molecular motion. So as a bit of personal context, in 2016, my father-in-law, Mark, was diagnosed with a terminal case of cancer and was basically given a 6-month prognosis. And he lived almost exactly 6 months. And near the end of his life, a clinical trial for Keytruda came online for his disease, but he was too sick to qualify for it. And I think in these conversations with Laura, something that hit me was, this is a technology that could help people like Mark. People like Mark and their families who, they don't need some 100-year jump into the future. They need 6 months. I went to envision a world where someone who has a heart attack and maybe would not even have time to be able to get a heart transplant can now get a heart transplant, where you go into an ER and there is a liquid nitrogen dewar sitting there that is filled with hearts that are ready to go. They can be transplanted in. Now, all of a sudden, organ donation is no longer something for chronic conditions. It is now something that is also for acute conditions. And before I left Adam's lab, I kind of took an informal poll of we knew that the acute slice was going to be the first thing we were going to do. So I took an informal poll. How many people think that the acute slice experiment that I'm proposing will work? And literally no one raised their hand.
Today, I'll be talking to Hunter Davis, the Chief Scientific Officer of Until Labs, previously known as Cradle, which is a startup working to build reversible cryopreservation for use in organ transport and eventually medical hibernation. Prior to starting the company, Hunter received a PhD in physical chemistry from Caltech and got a postdoc in neuroscience at Harvard. Today, we'll be talking about the recent progress report that Until Labs put out, what cryopreservation problems keep Hunter up at night, and a lot more. Thank you for coming onto the podcast, Hunter.
Thanks for having me.
So just to set the stage, I'd love if you could give me a very general overview of what cryopreservation exactly is and the primary roadblocks to outright solving the problem.
Sure. So, if we look back to the origins of using temperature as a knob, you can actually go all the way back to 1776. So at this point, it's actually observed that sperm under a microscope could be cooled down to hypothermic temperatures, and their motility would decrease. And then when it was rewarmed, it would come back. And this led to some hypothesizing about what might be causing this. Fast forward to around 1950, and people discovered that not only could you cool things to hypothermic temperatures, you could actually add cryoprotectants into these molecules, and you could actually cool them entirely, basically go down to the point completely arrested molecular motion. Fast forward again to sort of more contemporary processes, and what you're trying to do is basically slow down molecular motion inside of cells in a variety of different contexts. So one that you might envision is for sort of a hypothermic use case. You have a patient who needs surgery. So in many of these cases, the ischemic time is far too short to actually complete the surgery at 37 degrees. One example of this is aortic arch surgery. So this is a heart surgery that can't be bypassed. And by default, what would happen is the brain would go through ischemia because you can't actually actively perfuse oxygenated solution into the brain during the surgery. So what the surgeon will actually do is they'll take the patient and they would cool them down to around 15 degrees Celsius. And then they can complete the heart surgery and then rewarm the patient. And this shows no long-term neurological side effects. Then you can look at something like an organ. So here we might want to slow down the metabolism of an organ during transport to be able to increase its viability window. Well, here we can take the organ and literally just put it on ice. And what this does is it just decreases the rate of all these metabolic processes that are happening inside of the organ, or in the case of the patient, inside of the body. Just basically reduces all of those by reducing the temperature. So you can think of it basically as between 0 and minus 130, danger zone, ice can form, below minus 130, safe, basically perpetually. So what does the process look like in practice? So you could take an organ, you load it up with some cryoprotectant molecules that reduce the rate of ice formation during this danger zone. Then you rapidly cool your sample from 0 to below minus 130, store it there, rewarm, and then unload the cryoprotectant from the organ or tissue. And then you can bring it back up to 37 degrees and biological function will resume.
Why don't we have this today?
Yeah, there's a lot of challenges with scaling this up. So actually, we do have it today in really simple systems. So one example of this would be cryopreservation of embryos for in vitro fertilization. So here you have something that's very small. So normally they're operating on embryos at the stage where it's like 4 to 6 cells. And here you can take the embryo, dip it into DMSO, dimethyl sulfoxide, and then quickly dip it into liquid nitrogen. This rapidly cools it through this danger zone, and embryos can be stored for decades in this state, and then rewarmed and implanted. And using the contemporary methods, the viability of this embryos that are going through this process is a little over 95%. So you actually have seen that the live birth rate that occurs after vitrified embryos has actually started to exceed those of fresh implantation. And the reason for this is the allowance for additional genetic testing, basically while the embryo is cryopreserved. So this does exist for really simple systems. There's also been some proofs of concept of bringing it up to more complex systems, like a rat kidney. So the John Bischoff lab at the University of Minnesota has actually shown that you can take a full rodent kidney, vitrify it, bring it down below this minus 130 degree state, bring it up, reimplant it into the rodent, and then it will basically support life for this rat. The challenge is that as you scale up, as you try to go up to something that's like the size of a human kidney, all the thermal transport becomes much more complicated, right? If you try to imagine cooling something that's the size of an embryo, I can go really fast. If I do something that's the size of a human kidney, which is around 150 grams, that's going to be much slower. So then in this competition between basically you getting down to the safe zone at minus 130 and the rate of continuous ice formation in that 0 to minus 130 range, you just basically start to lose out because you can't cool fast enough. And similarly, rewarming becomes a challenge.
When you mentioned earlier about how like you can't just perfuse a transplanted organ with oxygenated blood to prevent ischemia, intuitively, like why is that the case? Why do you need to freeze to actually preserve like the cellular state of the organ, and why can't you just continuously just pump oxygenated blood through it?
Yes, that's a great question. So there actually are technologies that exist on the market right now that will perfuse hyperoxygenated fluid, and they do this in either like cold perfusion context traditionally. So there's a bunch of these products that exist on the market that can increase the viability of the organs that will then be donated. But all of them still have basically the organ still times out at some point.
I guess like what are the specific reactions?
What are the mechanisms that are that can account for here? I mean, so one thing is that now the organ is in isolation, and there's a bunch of, so let's think of like a kidney in isolation. Well, now I don't have a liver. So any toxins that are required, that need to be cleared by the liver, the circuit isn't going to be able to take care of this. We don't have dialysis for a liver, for example. So I think that part of this is like you have taken the organ like out of the context of being in like a multi-organ system that is responsible for clearing a bunch of the toxins that are going to get generated from like the metabolism of anyone outside of the concept of the other.
That makes sense. And like moving a little bit onto like the cryopreservation step, like first you have this vitrification step, second you have the rewarming step. Focusing on the vitrification part, what like you mentioned that like you physically stop the water molecules from interlocking with one another, and you like one way you can do this is by freezing really fast, such that they don't have time to lock into one another. Another way is adding in cryoprotectant agents, which prevent the water molecules from doing that. What are cryoprotectants actually doing? Like beyond that like very simple mental model.
Yeah, that's great. So I think there's a couple things to keep in mind here. Most cryoprotectants that you're going to add are not going to completely prevent the formation of ice in perpetuity. You can think of it as like reducing a reaction rate. So if you think of like the liquid to solid water as, basically just like a first order rate equation. And this is the so-called, there's like this thing called classical nucleation theory. It basically predicts the rate of conversion from liquid water to solid ice. Cryoprotectants basically increase the activation energy of that liquid to solid transition. There's still a very molecular question of like, how do they do that? There's a couple of different mechanisms of action here. So one that you can look at is actually direct hydrogen bonding of like water molecules. So you can imagine the sort of like rotational like tumbling that's required for water molecules to align into hexagonal ice. If I can just slow that down by hydrogen bonding to the water, then I'll reduce the rate of that alignment and buy myself more time to be able to cool down below minus 130. Other things is just like generally increasing the viscosity of the solution. Like, if you look at like the Stokes-Einstein model, for diffusion in a fluid, it's obviously inversely proportional to the viscosity of the fluid. So these cryoprotectant molecules tend to directly hydrogen bond water, to be viscous. There's also some interesting alternative mechanisms of action that you can explore. So looking to nature, for example, there are these things called antifreeze proteins. So instead of directly hydrogen bonding to liquid water, what they actually do is they preferentially bind to solid phase water. So they allow some isonuclei to form. And then basically by cooperatively hydrogen bonding, these macromolecules will stick to the ice surface and prevent it from extending. So there's a few different mechanisms of action. And you could think to like basically exploit all of them together in like a cocktail.
And I imagine the type of cryoprotectant agent that Until is most concerned with is the former category of like directly binding to hydrogen. And you don't care too much about the antifreeze proteins.
Yeah, I think that we're open to exploring basically all of these mechanisms of action. I think in the end, when you want to do vitrification, the thing that's going to have to do the dominant work is going to be these so-called like colligative agents. So these are like the small molecules that are like actually directly interacting with liquid water. If you think about like the antifreeze proteins that like nature uses, most of the time, well, always, these organisms don't care about surviving down to minus 130.
No.
What they care about is surviving in equilibrium at like minus 5 degrees. These are very different processes, like to basically try to prevent the extension of ice in a so-called like supercooled state, like just below zero. It's just a fundamentally different problem than trying to survive all the way through down to minus 130 and back. So yeah, the primary focus is on these like colligative agents.
When you look at the cryopreservation literature, has there been any evidence to suggest that using antifreeze proteins and being like okay with just like -5, like mildly arrested or mild cryopreservation is good enough in some cases, or there hasn't been too much work in that direction?
Yeah, so not specific to antifreeze proteins, though I think that there are some applications here where people have been trying to use either things inspired by antifreeze proteins, actually is mostly it. But there is a whole stack of products that will hit the market that are these sort of like super cooled organ solutions. So I think of this as basically like an extension of hypothermia, where you can go instead of to 4, now you can go to like -4. And there's a few different tricks that people have used here. All of them have their trade-offs. I would imagine that similar to how Until will be bringing a vitrification product to market, I would imagine there will be some like near sub-zero storage products as well that will have their own trade-offs. And in the end, I think the thing that's going to matter for like basically what wins out and becomes the sort of dominant way of transporting organs is going to be the thing that gives the patient's best outcomes.
Yeah, that makes sense. Amongst the cryoprotectant agents that you guys are actively developing, how much work actually goes into improving those agents versus improving like the next step, which is rewarming?
Yeah, so we view this as a very multifaceted problem. And I think that one of the things that originally fascinated me about it is that it's one of the few scientific problems that I've seen before that brings together things from, applied physics, chemistry, transplant biology, all the way to like hardcore electrical engineering and like power electronics. And we work on all of these things simultaneously. I view them as relaxing each other's constraints. So basically, if you have devices that are good at rewarming quickly, well, then my molecular agent doesn't need to be like quite as performant, and vice versa, right? Like if I have the like killer molecular agent, then maybe I need a very like facile, like easy device. In the end, I think these constraints are pretty hardened. So it's going to be some combination of these solutions in the middle. But yeah, we work on, I would say, pretty intensively on both improving the cryoprotectant agents and on improving the devices that do the cooling rewarming.
Okay. I'm going to wrap back to these like questions about cryoprotectants and rewarming in a bit. But what I really want to talk about, what actually like started this conversation to begin with, was you guys released a progress report in September 2024 alongside your Series A announcement that basically described how you recovered electrical activity from a slice of mice cerebellum, I think. They were frozen, rewarmed, and you observed some level of electrical activity in the neurons there. This is obviously incredibly impressive work. But you did mention in the paper or in the progress report about how there's more to neural functionality than simply recovering neural activity. What else is there? Yeah.
So I think that first of all, I think it's maybe worthwhile to go into like why we did that as like a first POC. So when Laura and I met and we were sort of talking about the idea of reversibly pausing biological function eventually for a whole organism, we sort of had the initial conversation of like, what are the falsifiable hypotheses here? Like, what are the experiments that we could do that would prove that this will not work? I think one of the first ones that we wanted to do was look at these like very delicate pieces of tissue, being like neural tissue. And so the easiest thing that we could come up with was basically doing these like cerebellar slices. It'd be very easy to like basically load these diffusively. We didn't need to do any perfusion. You could cool and rewarm them very quickly. And the cerebellum is known for having very periodic firing. So you would be able to know if you got, at least on like the single cell level, you would be able to tell if you were getting like action potentials that made sense. And so we sort of performed that experiment. And like you were saying, we saw the recovery of some electrical activity of action potentials in the slice. But yeah, there's a question of what comes next. Actually, a piece of very impressive work that sort of developed along this axis came out of Alex German's lab in Germany this year. And he was actually able to show, using a very similar protocol, that you can recover long-term potentiation from these acute slices. So this is basically, you take, like one canonical example would be like, take the Schaefer collateral in the hippocampus. So here there's basically a bundle of axons that are all synapsed in a very similar location in the hippocampus. And you can actually look for potentiation of those synapses. So this is like basically bit flip for memory. And what he was able to show basically was that you can recover LTP in these slices. So this is all really interesting. And I think it's useful as like sort of a microcircuit level problem. But if you were to talk about like, what does it take to like preserve like full like neural function? This is a much more complex question than the microcircuit inside of a slice. And eventually you have to go to the brain as a whole and to the organism as a whole. But this is like a very deep challenge that I think will take quite a bit of time to actually get to the point that you can like make traction against it, is my presumption.
Yeah. One pretty shocking thing I found out after we had our initial conversation a while back is that the ultimate goal of, at least like the short-term goal of Until Labs right now, is not whole brain preservation. Right now, it is, I think you said kidney preservation. Why switch to kidney? Like when I read that report, I was like, okay, this is one step to whole brain cryopreservation.
Yep.
Why move to a different organ?
Yeah, so I think that the thing that we have been interested in as the moonshot from the beginning is like reversible cryopreservation of an entire patient. And this would involve basically like allowing someone to pause their biological time, like as a whole. There are some really useful things about going through the process of doing this on an organ by organ basis first. One, this allows us to get basically therapies to patients in need in a like very immediate way. Like you can deliver care to people who need it and use cryopreservation to do it. There's also a natural scientific roadmap that is built out of this, right? Where you can start to basically learn technologies on like isolated test beds where you can learn about how to preserve kidney, heart, lung, these kinds of things. And we view this as like a natural, like basically foundational platform on which we can build towards our eventual goal of being able to do basically hibernation of an entire person.
Why choose kidney over anything else?
Yeah, so we're actually pretty organ agnostic. I think that kidney is the one that's like commonly talked about, and like I'm happy to like discuss like nephrology as a particular application. But I think one thing that's nice about vitrification is because it leverages physics instead of like going after very specific biomolecular pathways, it's somewhat organ agnostic. Which is, I think, exceptional compared to some other chemical strategies for preservation.
Yeah. Returning back to the progress report, just because I imagine a lot of the questions, like at least like external people may have about cryopreservation, are probably answered or at least raised by the report. In the report, you did cryopreservation across 4 mouse samples and found, like I think, like the primary results were over 1 mouse, but I think there were discussions over the other 3 as well. But I did want to ask, how much heterogeneity were there in your success in being able to recover electrical activity from all 4 rats?
Yeah, we were able to see electrical activity recovered from all 4 rats. There was a large degree of heterogeneity in the basically amount of electrical activity that we recovered. The traces that were placed into the report, I think, are representative of the group. But particularly in that iteration of the device, I think we were very early, and I definitely think that our QC was not as dialed. So there was quite a bit of heterogeneity in things like the cooling rates and the rewarming rates that were coming out of this little cartridge that we had.
Why, what do you imagine the primary access of variability? Like, how much of it is like just like an experimental batch effect versus like some rats are perhaps better at being cooled than others?
I wish that I could tell you that it was like down to the rats. I'm pretty sure at this point, at least particularly at the point that we were filing the report, I would chalk it up to experimental variability.
Okay, that makes sense. Returning back to the kidney cooling and rewarming moonshot goal. What is your metric for like you freeze a whole kidney, you rewarm it back up? How do you tell whether this kidney is good?
That's a great question. And this is something that actually I didn't appreciate until we started working on it, which is that there's this whole literature and like an entire field of basically organ evaluation in isolation outside of a body. So these are so-called like normothermic machine perfusion. So this is for the electronics people. This is basically like a test bench for your organ. You can hook up basically fluidic circuits into, if you imagine like a kidney has like basically like one inlet and two outlets. It's got its arterial inlet and it's got a ureter and a venous outlet. I can basically press certain fluids into the arterial inlet and then measure the fluids that are coming out of both the ureter and of the venous effluent side. This allows you to measure things like what is the uptake of glucose in the organ. You can measure things like what is the lactate concentration in the stuff that is coming out of the venous side. So there's a whole host of these like biomarkers that have actually been established by the transplant community. I think that one sort of like marker of like good cryopreservation work, as you guys are looking through the literature, is actually how well do they sort of reproduce the metrics that have been like established and like known to work as predictors of like transplant outcomes, of which there's like a whole literature on this.
How are these metrics for kidney damage established by the transplant community? Are they like fully dialed in? This is like as good as it gets, or there's still like room to improve there?
I would argue that there's still room to improve. I mean, it's still like an active area of research improving the correlation of these like NMP assays to transplant outcomes. I think it's not like it is. I think it's established that it is possible to correlate these things. I think that no one would claim that we were like done with like how to like draw the best conclusions.
And right now, are you still doing like mice kidneys, or are you moved on to other species?
I think you need to move up to pig as the standard preclinical model, and it's for the reason of the size. So basically, there's so many of these constraints have to do with basically matching the size of the organs that you're interested in.
At what point, like maybe this is kind of an unanswered question in the transplant field, but how much do what you learn from like pig kidneys transfer to human kidneys?
Yeah, and so this is like classic question of like the translatability of any of these assays. And I think that particularly for something like vitrification, we're going to have to see, and we're going to have to be intelligent with our trial design. I think that there are ways to access things like human organs that would otherwise be discarded to check for some of these questions. But like this, I think is a standard translatability question, and particularly because we're going to be pressing vitrification through for the first time, I think that we're going to get to learn the answer to that question.
At what point in time, like, are you still right now operating on like, I'm not even sure if this is like I'll just ask the question, like slices of kidneys, or are you doing the full kidney at any given run?
I think you need to be doing the full kidney.
Gotcha,
The reason for this, so there's ways to like sort of chop this up and do these things on like tissues, but like in the end, vasculature is like a really critical part of this process. And I think this is probably something that I should have gone through in more detail as I was describing the original protocol. But like the only reason this is possible is because of vasculature. Like you need to be able to do mass transport of this cryoprotectant deep into tissue. Like the heat diffusion that I was complaining about previously, because this kidney is 150 grams, the same logic would apply for loading the cryoprotectant if you weren't to use vasculature, right? If I were to try to load it from the outside, it would take forever. But we actually are perfusing through the vasculature. So I think a lot of the sort of development that needs doing is actually on how do you efficiently transport cryoprotective agents like into a kidney or another organ.
How much of the where do most of the ideas in the room usually come from? Are they from the nephrologists? Are they from the electrical engineers? Are they from physics people? Like what plays into like pushing for the kidney preservation goal?
Yeah, the only reason that we're able to make any progress is that the answer is all of them.
Okay.
But like, I mean, I could give you, there are examples of times where I think like really great ideas have come from unexpected places. So for example, like Andrew Olvested, who's our head of applied physics, was previously running like battery materials research at Tesla.
Interesting.
And has like a very interesting perspective on basically like material discovery, which is like critical to what we're working on.
Yeah.
And then there's stuff that comes from like Gerald Brandeker, who just joined as our chief medical officer, who has decades of experience in transplant, and he has obviously his own lens on like the way that these things need doing inside of organs. So I think that the magic that I have seen always happens actually when these people get in a room and they have conversations, and it basically they can relax each other's constraints. You have this basically like specter of another field where it's like a black box, and it's like, oh, this seems like quite challenging or hard, because you have some perhaps like overestimation of the level of constraint that collaborator has. We actually just get these people in a room and they actually have a conversation. I think that's where you can like unlock a lot of upgrades to the protocol.
How much is like returning back to the report? You said you kept the neural tissue at negative 196 degrees centigrade for about a minute. I imagine you're going to do the exact same for kidneys as well. Why not extend that out to like a day, a month, a year? Like why choose a minute? Was just like you don't expect anything to change after that point, or?
Yeah, so that's a great question. For the tissue slices, it was a very simple thing of just, this is the way that we built the device. Like I literally cannot express to you how quickly this device was thrown together to be able to do this report. And it took a lot of optimization on the protocol side, but literally we had this idea for this device and then like threw it together, mostly with thinking towards like screening, not towards like, hey, we need to go get this like milestone and like be able to report it out. It was mostly try to screen cryoprotectants. But for the kidney, I imagine that we'll store it for longer. There's a natural question that I think is at the core of what you're getting at, though, which is like, why does it matter or not matter? And I would contend that it actually doesn't matter. You can store it down there to be able to sort of prove out the theory. But the reality is, because water is 13 log units more viscous down in this vitrified state than it is at room temperature, there's a massive time dilation. Think like seconds at room temp to millions of years in vitrified state for equivalent diffusion distances. So for any reasonable timetable, like think like days, months, years, it doesn't really matter because nothing's going to have moved in this glass state.
One instinctive thought I would have is like the reason you may care about like a day or a month is like when you're freezing something, you remove all of the blood from it and replace it with cryoprotectant. At least that's my mental model of it. The reason you may care about it, like testing it out for like a day, is what if you left like a little bit of blood in there, and like that blood has like will continue to like accrue damage over time. Is that at all like a?
I don't think so. So actually, if you got, so let's say I left like some random red blood cells inside of the vasculature. Okay. It's like, what's going to happen? Well, first of all, the water inside of those red blood cells is still going to exchange. So they would still equilibrate with all the cryoprotectant that you're perfusing in there. And also, let's say that maybe there's like a water pocket inside of this. Well, if I got any ice on the way down, and let's say I induced damage as a result of that, that damage is now there.
Okay.
There's no like basically period of time. Because even like, if I have ice that is nucleated, it's still not extending below minus 130. There's this like, it really is the case that like all the damage is getting done in this like minus 130 to 0 range. That definitely doesn't mean that you're okay, right? I mean, if you have nucleated ice on the way down, there's actually a annoying / interesting asymmetry in the physics here, where you tend to like form more nuclei as you're cooling, and then you tend to extend them while you're warming. And that extension is really what kills the tissue, because that's where you start to tear through like quite a few cells. And tear things up.
One question I initially had when we first had this conversation was, let's say, like centuries from now, we're all cryofrozen on the ship going through the stars. How much do we need to worry about background radiation of the universe, like still affecting our genomes?
Yeah, I mean, I can't I can't prevent the DNA from getting nicked from radiation as a result of it being vitrified.
Okay.
That is the case. But I think that at the time that we have all of the technology available for vitrification and deep space exploration, I would sincerely hope that we can figure out how to line the ship with lead or something.
Yeah, that makes sense. Returning back to the question of like metrics of damage you're looking for when you're cryopreserving an organ. For the brain, it's neural activity, it's LTP. For kidneys, it's this platform you just talked about. Do you think you'll have to like custom make this for every single organ, or pretty much every organ in the human body has some sort of like well-established protocol as to how you assess damage?
I think that at least the donor organs, which are the first ones that we'll be interested in, I think there's pretty canonical ways of evaluating their function. I think the things that we have to build out bespoke are things that are not so much for like proving out a milestone of like, is this thing healthy or not? There we can always reference back to the transplant community. I think the thing where we're both working on our own and also looking to the cryobiology community as well is how do you assess things that are like very specific to the cryo process? Like there are damage mechanisms that you want to be looking for and optimizing against that are specific to like basically vitrification and cryoprotectant loading.
What's an example?
So an example here might be like figuring out the time constant that you can like load the cryoprotectant in. So obviously you would like to get the cryoprotectant in there very quickly. You don't want to put it in too quickly.
Why not too quickly?
Yeah, that's a great question. So I want you to, let's do a really simple thought experiment first. Okay, so I have a cell in a test tube by itself, just a cell. And to start, it is in a solution that is isotonic with the interior of the cell. So basically like water is exchanging into the cell just as quickly as it's exchanging out of the cell. So a key part about cell membranes is they're really good at exchanging water. So there's a protein that actually is in the membrane called aquaporin. And its entire job is being just a water-specific transporter. Water freely diffuses through it in and out. So now what happens is if I take, let's say, half the water out of the extracellular space and I replace it with cryoprotectants. So very permeable cryoprotectants are still going to be, 100x slower at diffusing across the cell membrane compared to water. So what invariably happens is initially you have an efflux of water. That water basically runs out of the cell. And then cryoprotectant can slowly get into the cell. So basically the cell immediately shrinks initially and then starts to re-expand. Well, if I shrink too much, then I basically die of osmotic shock. And similarly on unloading, and unloading actually is an even stiffer constraint. If it's loaded with cryoprotectant and then I add a bunch of water on the extracellular space, then basically the cell inflates like a balloon and then pops. So that's the constraint on basically not loading or unloading too quickly. You can imagine extending this very simple thought experiment of a single cell up to basically like that first like layer of the vasculature, that first like endothelial layer of the vasculature. It's seeing that sort of like maximum osmotic shock because you're trying to increase the cryoprotectant. So when you're loading this, you don't just go from like basically zero isotonic solution to full-blown cryoprotectant. You actually see the protocol looks kind of like a ramp. Where you're like linearly increasing the cryoprotectant as a function of time.
Is there like established theory as to like what the slope of this line should look like, or is it kind of empirically determined?
Yeah, so I mean, you can calculate what it should be. The thing that is challenging is that you don't necessarily know all the like transport metrics that you need to be able to establish. But like, I think it's still useful to go through the first principles of like, how would you think about this? And basically it's a balancing between the relative permeability of the cryoprotectant compared to the water. And then you also need basically some transport model of like, how is this cryoprotectant getting through the vasculature and equilibrating basically along the flow path. If you have basically these together, then you can establish like a sort of rough heuristic of what it should look like. Things that make this really challenging are that, basically not having the permeability coefficients for all the cryoprotectants in your formulation for the cell types that it's going to be seeing. That really ends up mattering. Other thing is that for some of these cryoprotectants, the permeability is actually a function of the cryoprotectant concentration. And then it's just incredibly hard to model. So I think like transport, one of the interesting, I think, biophysics questions that's left in cryopreservation is like good transport models for the cryoprotection into the tissue.
How, in practice, how much do you use like models versus just empirically determine that?
Yeah, so I think that you want to use both. Definitely don't want to just like basically write it down on pen and paper. Definitely the biologists in the company would prefer that I used a whiteboard marker less than I do. But I think that oftentimes you can make these things sing together. So for example, we really prioritize making like simple assays, not just for like how well are we doing, but also to try to establish these metrics, try to build models. Because you can't proceed with, for example, like how do I know what slope to load the organ? Like we're pretty committed to having a first principles, let's say hypothesis that's built off of some simple cellular model or some like simple like reduced experiment that can be done at high throughput. And then we basically make a best guess and adjust from there. But like, it always requires adjustment in the context of an organ because it's so complex.
How much do different cell types matter? Are all human cells, let's say, are all like happy with the exact same slope, or some cell types are especially sensitive to osmotic pressure and like they will almost always like pop if you
I mean, I think like so there's talking like a physicist, I would say to first order you can consider them as all the same, and then there's corrections. And like one way of thinking about this is it is the case that like aquaporin is the dominant way that water gets into and out of all cells. So that sort of story that I told you, that's true across all the cells. But the specific permeability of a given cryoprotectant is going to be different for different cell types because, for example, they use things like they tend to hijack things like urea transporters to get into the cell. Well, obviously, the density of urea transporters is going to be different in different cell types. So the relative permeability of these cryoprotectants in different cell types is going to be different.
Yeah. How much do, like if you move beyond organs and you're like, you start to consider like, I'm trying to think of like something that isn't an organ, like blood vessels, for example. Maybe there are probably is blood vessel transplantation, but it doesn't sound super trivial to just like perfuse blood through it and let's like see what pops out of the other side. It's more of like a morphology question. Like, are there good metrics there? And if not, do you have to generally create your own?
Yeah. So fortunately, again, if you want to do so, actually vessel cryopreservation is its own field.
Okay.
It exists. Yeah. And there are things like H&E staining is really useful. This is also a place where you can lean on the medical field and look at basically established protocols for histology and look to like, what is the sort of like inner lumen supposed to look like? Like there's a bunch of these like structural assays that you have to sort of lean on because like you're right. You can't do the same thing of like asking the question of like, is the organ functional? Because that's just a pipe. So it's not going to give you any information.
Yeah. We spent a long time talking about the actual like freezing process itself. Moving on to the rewarming side, what does actually look like in practice?
Yeah. So I think that first let's start with like, why do you need to rewarm quickly? We already sort of talked about this, but like we want to outcompete the formation of ice on the way up. And this is particularly challenging because ice nuclei that have been formed on the way down but are very small are going to extend really quickly during the rewarming. So this placed a huge pressure on the field to basically create methods that would homogeneously and rapidly rewarm tissue. So you think of a few different ways that you could try to like rewarm something that's the size of a kidney. Maybe like the most naive one is like, I just take it and I just like put it in warm solution. Okay. Here, again, we have the problem of the heat diffusion equation. Basically, everything tries to diffuse in from the outside and it's going to be way too slow. Maybe you'd be able to warm the surface really quickly, but the core is going to stay cold. Similarly, maybe you could think of like, okay, we'll like throw it in a microwave. But there again, you get cold and hot spots. If you've ever tried to like rewarm something that's like very extended in your microwave, the surface gets warm, but the core does not. So actually one of the innovations that came out of the Bischoff lab at the University of Minnesota was they figured out that you can use biocompatible iron oxide nanoparticles that are perfused into the vasculature of the kidney, basically fill it with metal, and then put the entire kidney into an alternating magnetic field. And what this does is it actually rewarms the kidney somewhat homogeneously, much like an induction heater in your kitchen. Basically, like you're like flipping the magnetic dipoles back and forth. That generates some heat that tends to heat the organ relatively homogeneously. As it would happen, this was actually the topic of like the second half of my doctorate. Not for the applications of like organ rewarming. Specifically, I was studying in the context of like cancer hyperthermia was the application I was looking at. But it's sort of a full circle moment for me that we've like circled back to this. So this is like one thing you could think to use is like basically alternating magnetic field heating. This is one thing that we're studying at Until. We're also studying some other methods for like volumetric rewarming. But I think like this is the canonical one that like the field is like sort of settling in on is this idea of using alternating magnetic fields in combination with magnetic nanoparticles.
Just to like set the order of operations, like the cryoprotectant agent and iron oxide nanoparticles are both given at the same time.
So yes, you basically think of it as like, if we have this like ramp of cryoprotectant that has to go into the organ, imagine like the last part of that ramp, you also dope in the iron oxide nanoparticles into your solution. So it's like a colloidal suspension of iron oxide nanoparticles inside of cryoprotectant.
Is there no interaction between the iron oxide and how the cryoprotectant actually works?
That's a great question. Actually, iron oxide nanoparticles can be ice nucleating agents if they're not coated properly. So the surface chemistry here actually becomes really interesting because you need things that are colloidally stable in cryoprotectants, which tend to be very high salt and like kind of messy. And then I should say high concentration of non-water substances. And you also need something that's not going to nucleate ices. You basically don't want to create like surfaces that tend to like allow for this like nucleation process to occur.
That makes sense. You mentioned earlier, and this is something I hadn't naively actually thought of, was like as you freeze, I can vaguely understand like water molecules like interlocking with one another to create these ice crystals. How come during rewarming there's also a chance for nucleation to happen?
Yeah.
It just feels like
It's deeply counterintuitive, right? Yeah. But you actually get more ice that forms on rewarming. It's like we can maybe walk through why.
Sure.
So basically between 0 and minus 130, the chemical potential energy of ice, it's like solid water, is lower than liquid water. This is true in that temperature range, whether you're warming through that range or cooling through it. But there's something that's actually like this asymmetry that we've been like getting at. I guess we can go into a little more detail. What ends up happening is like as you're cooling, the temperature at which you get maximum nucleations, that's like the formation of these like tiny nuclei, is actually colder than the maximum rate of extension of nuclei. So what ends up happening is on the way down, you go through the temperature zone of maximum extension. Then you get to the temperature of maximum nucleation. So basically, you go through extension, but there's nothing to extend. And then you nucleate. On the way up, I nucleate a little bit more, and then I extend everything that I've nucleated on the way down and on the way up. So basically, there's this constraint where basically, because you go through on the way up, the nucleation, and then this like maximum extension phase, which is relatively warmer, you actually produce the majority of the actually volume of ice gets produced on rewarming, assuming you do symmetric cooling and warming rates.
Okay, so if you have like no ice crystals in your solution, and you rewarm, there's no chance for further crystals to form.
Oh no, you can. Just to clarify. So basically, if you think of it as like the rate that you're sort of warming or cooling, is sort of separate from the question of just is the equilibrium of water, ice, or liquid at a given temperature, at a given absolute temperature, not at a d temperature dt, not at a change. So I mean, just think about like in terms of the physics here, think of it as like if there's a water molecule that is at minus 80 degrees, it doesn't know or care if you are currently cooling it or warming it, right? So basically, it is equally likely to do nucleation or do extension during the cooling or rewarming phase. You can think of basically just like running a path integral over this entire curve to be able to get the amount of ice that is formed.
Like combining these two areas of like, it seems like two very difficult problems to solve, like building very good cryoprotectant agents and also building very good ways to rewarm a frozen tissue or organ. Which of those two axes do you consider like hardest, easiest, but like what problems in both keep you up at night?
Yeah, I mean, both keep me up at night. Okay. I think that one thing that is nice about the rewarming system is we can bring to bear some like pretty strong power electronics expertise that we have brought into the company to be able to build out a few different like technologies there. And I think that we're pretty committed to building out like a wide technology platform. So we look at a few different mechanisms of action here. On the molecular side, I think there's some give and take here because the reality is that we've been using the field have been using the same cryoprotectants, like same basically like few dozen cryoprotectants have been used like since the 1950s. Like basically glycerol and then DMSO were like quickly discovered. A lot of people still use glycerol and DMSO. No. There's obviously a very large chemical space that you could search for cryoprotectants. And I think that you can find things that work better. But the question is how much better and how much less toxic can you get? And so because these things are like these relax each other's constraints, I don't think of one as necessarily being like harder than the other. because if I were able to get traction on it and make progress on it, then I would just demand more of it.
Sure.
And that actually like builds a really cool team environment. Like practically, it builds a very cool team environment because there is no, like for our applied physicists who are like thinking about these like molecular interactions, there is no like, we're done. It's just like, you just keep chasing basically continuously better versions of this. For the people who work on like our cooling systems, there is no like, we're done with like improving the homogeneity and like rate of cooling. I think this is true of the field writ large. This is why I think this is like a relatively, I think this is why this is a relatively like interdisciplinary, like multidisciplinary field as a whole, is that everybody can kind of like find their angle through which their expertise can like help with cryobiology.
Yeah. With the development of better cryoprotectants, I think the one that you used in the September 2024 report was like a well-established one with like one particular ingredient removed.
Yep.
I'm curious about like the rationale. It was just they're like you just like wanted to get the report out of the way, and like there wasn't that much work on like fiddling around with the cryoprotectants.
Yep.
Yeah.
Yeah, so the report actually came out before we had a molecular development team.
Okay. Okay.
So we now have a molecular development team that looks at basically novel cryoprotectants. So we were basically working off of a sheet of stuff that had been previously used. Previously.
When you say that like there's only been a handful of cryoprotectant agents developed since the 1950s, is that because finding better ones has been too difficult, or more because like there's just like it's been like pretty high hanging fruit that people haven't really been attracted to solving?
You know, it is a little bit complicated to like for me to understand the like relative like social milieu that has like driven this, because I think that there actually has been like quite good work on like screening new cryoprotective agents. I mean, thinking about people like the Toner lab, like the Higgins lab, like there are labs that have been like really focused on how to like screen better cryoprotective agents.
Yeah.
And yet everybody's still using ethylene glycol, propylene glycol, formamide, DMSO. Like these are like there are various basically combinations of these. And so you'll see like V3, VMP, like all these things thrown around in the literature. But fundamentally, we're just basically like mixing around like a few different agents. And occasionally there will be like a new one that will come in, or like a new additive that will come in. Some of them are quite toxic. But yeah, it is actually surprising to me because there has been like really quality academic work on screening these things. And yet like people are still using the same stuff. So it's an interesting contradiction.
Is it potentially because there's not that many groups focused on actively translating this to a full actual organ?
I think it's a big lift to do this in whole organs. There are examples of people like doing the full stack. So I mean, there's great work coming out of like a few different labs to try to like scale this up. I think that like John Bischoff's lab at UMaine would be a good example of this. Like the Toner and Tessier labs at Harvard would be another good example.
On the flip side of like how do you improve the actual like rewarming process? Is there anything? Is iron oxide like it? Like will we ever get better than that?
Yeah, I mean, there are examples of, is iron oxide it, meaning like is magnetic warming it, or like what?
Yeah, it's magnetic warming it. Even the agent as to like how you do the magnetic warming, is that also like as optimized as it could be?
No, I think that you can continue to make better versions of this. I mean, I think like John Bischoff's group has continued to do work on improving the sort of core compositions. Like we have done like our own work on improving like core composition materials. There's like a whole field obviously that pre-exists for like how to do really good coupling of magnetic fields with nanoparticles. This is not specific to the problem of cryobiology. I think honestly, like as with many questions inside of cryobiology, one need only look basically like outside of the field. And this is probably true of any discipline in science. Like look outside of the narrow aperture and you will find someone else who has solved a similar problem. This is a good example of that.
I guess like even outside of magnetic induction, is there any other like upcoming or perhaps like already like well-established approach that you view as particularly promising?
Something that I was interested in that came out recently was the use of like electric fields and like basically microwave, like actually very like tens of megahertz frequency electric fields for rewarming a rabbit kidney. So this was basically Greg Fahey was the person who led this study. And I just don't see how this scales. I think that maybe at one day it will be doable, but it is like quite challenging to think of how do you scale this from something that's like rabbit sized up to something the scale of like a human organ.
Is it just because like you mentioned earlier about how like microwaving has the chance to introduce such like large thermal gradients or something else?
There's a bunch of, and like some of the physics here is like a little bit subtle, but yeah, there's a tendency for basically hotspots to form inside of the organ when you're using electric fields, which the way of thinking about this like very intuitively is like in one case, I'm trying to directly couple to water, like the thing that is everywhere inside of the organ. And so by definition, my energy sort of like is going to get attenuated just a little bit as I'm trying to go through.
Mm-hmm.
Whereas for the iron oxide, this is like an exogenously like introduced material that has a very high like coupling coefficient that is very localized to the particle itself. So that basically there's like some arguments for basically increasing the penetration depth using that.
For the magnetic stuff, like what are the waves actually interacting with if you replace all the water?
What are the waves interacting with the magnetic fields?
Yeah.
So they're interacting with the nanoparticles.
Oh, okay. Yeah. Okay. They're still using the iron oxide.
Sorry. In the case of any magnetic field stimulation, you're going to have to use iron oxide nanoparticles.
Okay.
Yeah. For electric field stimulation, you can basically directly excite water molecules themselves.
Gotcha. Okay. One thing that has been kind of like you've like hinted at this or perhaps like explicitly mentioned at one point, all this inherently depends on the vascular system distributing everything nicely and equally. How does this work for tissues that don't perhaps are not perhaps as like heavily vascularized? I think like even within an organ, I'm sure like not every single little bit of it is like there's like potentially like fascia that does not have that much vasculature attached to it. How much work goes into thinking about that? Is that kind of like a long-term thing? Like we don't need to worry about that right now? Or that's like on your mind?
Yeah, I mean, it is on the mind insofar as like we are continuously thinking about the entire scientific program and not just what is right in front of us, but it is not right in front of us, in fact. Like there are areas of the kidney that are less vascularized than others, but all of them are sufficiently vascularized that you can, with some intelligent protocol development, get the cryoprotectant where it needs to go and get the heating power where it needs to go. But yeah, you're right that the vascular density even inside of a given organ is not homogeneous.
How like you mentioned like a few metrics you used thus far for like measuring like function of the organ post warming. Are there metrics to establish like how well the perfusion process worked in the first place?
Yeah, so there's a few different ways of doing this. So you can do there's a variety. One is I can just look at when I cool the entire thing down and vitrify it. So this is like a sort of midpoint assay. You can actually use micro CT to figure out, are there ice nuclei somewhere inside of this organ? Because you can actually look for the crystals themselves. There's also some like crazy applications of MRI where you can look for chemical exchange with your cryoprotective agent inside of the MRI. And that can basically give you an idea of like local concentration of a given molecule. Actually, Alex German, the guy that I referenced previously, was a radiologist first before becoming a cryobiologist. He published a really cool paper on using something called CEST imaging to look for the concentration of given cryoprotectant species, basically deep and extended tissue.
Okay. And like one question I had while like reading the September 2024 report was this experiment was done on 4 mice, which is a relatively low end.
Yeah.
And that made me think like how expensive was this whole process? Like how many shots on goal do you have when you're running Until Labs? So do you do like you guys all like sit in the room, you think very hard, and then you run like $1 million experiment? Or is it more like there's like a bunch of like intermediate assays you can do to like get like sanity check?
Yeah, this is great. So definitely the mice are less expensive than the larger preclinical models for sure. But the way I like to think about this is like a funnel. And at the top of the funnel, you have in silico models. So basically you want to do as well as you can with in silico models because they are very cheap to run compared to everything that's going to come downstream in this pipeline. Then sort of below the in silico models, you have things that you can do in a test tube or things that don't require any interaction with biology. A canonical example of this would be things like differential scanning calorimetry. So here you can take a cryoprotectant that is in water, you can put it in a tiny little sample and cool it down to minus 130 degrees. And you can look for basically an exothermic peak. This is like heat flow out of your sample during the cooling or during the rewarming process. If you see this exothermic peak, that's indicative of ice formation. Basically, the liquid to solid transition in that temperature range is exothermic. So you'll be able to basically tell, oh, I got ice in this little solution. And now this solution still hasn't like seen cells yet.
Mhm.
You can then imagine screening like many of these such compounds in cultured cells.
Yeah.
And that gives you some idea of toxicity. And then from there, I think that this is where like a lot of our work is done. It's like, what is the basically gap? Like, how do you bridge between doing like cells and going all the way to an organ?
Yeah.
Because setting up organ experiments, like you were saying, is like both expensive in terms of capital, but mostly it's that they're very time expensive. These are very long protocols. And I'm incredibly proud of our team for their ability to like work through some of these like arduous protocols, but you don't want to waste that.
Yeah.
So I think that there's a lot of focus on how can we move stuff up up the funnel to more translational assays.
To give some sense of like how expensive this protocol is from a time perspective, like what did it take to get these like rat cerebellums frozen and rewarmed?
Yeah, so the rat like acute slices, that's not so bad.
Okay.
That's not so bad. The challenge is when you want to actually do a preclinical model of an organ. And that obviously requires like actually taking the organ out of the animal or like getting it. And then you're going to have to do things like flush the blood out of the organ. You need to load with cryoprotectant. You need to do the vitrification process, do the rewarming process, unload the cryoprotectant, and then do the assay.
Mm-hmm.
And the assays themselves take several hours to be evaluating the function of the organ. So it's a very long process if you want to get down to like an entire organ as an evaluation.
That makes sense. One question that immediately popped up in my head was how is there like any I imagine like you want to rewarm uniformly to prevent these like thermal gradients and prevent like mechanical stress. Is there any world in which you have like a molecule that you can inject alongside the cryoprotectants to help with that? Like, are there such things as cryoprotectants that like help prevent mechanical stress?
Yeah, so I think mechanical stress is one that would be interesting to look into. I haven't looked specifically at that, but what we have looked at is a set of molecules that would help with not necessarily blocking ice, but help alleviate any damage that would be induced.
Yeah.
And we're definitely not the only ones who are looking at this. I think like the field as a whole is looking for these sort of like additive molecules that can help with things like the shock that is induced by going down and coming back up again.
Mm-hmm.
There are also some cryoprotective agents whose mechanism of action is strictly what I would call like biomechanical, that instead of blocking ice, what they do is they actually intercalate into the biological membrane and strengthen it. So you can actually have these they're like polymer molecules that have been developed that will actually like sit transmembrane and will basically strengthen like the biological membrane. This obviously works much better in like small like cells or like embryo context.
Mm-hmm.
Pretty hard to like get that to work at the scale of an organ, but it is like an active area of research.
Why is it difficult to get to work at the scale of an organ?
Just like loading things that are that large homogeneously outside of the vasculature, it's like becomes challenging. Like the transport here is like one of the key limiting factors for like any of these approaches.
I think when we first talked, I think one of the most interesting questions I had and most interesting answers you gave was you fill up this like organ with cryoprotectants and iron oxide nanoparticles and you rewarm it back up. How does the body deal with all this stuff that's left over?
Yeah, so you really don't want to leave anything behind at 37, for sure. And so I think a lot of the work that we do is basically making sure that you're able to like effectively clear all these cryoprotectants.
Mm-hmm.
I think that there is like sometimes a misunderstanding of like a beautiful symmetry here. So when you go down to around 4 degrees, which is where we load the cryoprotectant into the organ, obviously the metabolism is much slower. Yeah. And as a result, the toxicity of any of these molecules is substantially reduced as long as you're loading down at 4 degrees. And we load between 4 and 10. Right, so you hold there, you load your cryoprotectant up. Similarly, when you want to go back and you want to unload, I think that oftentimes there's this like misconception. It's like, oh, I need to add like a chelator or something to like take the cryoprotectant out. But you can actually unload the cryoprotectant the exact same way that you loaded the cryoprotectant, which is just slowly reducing the concentration of the cryoprotectant in what's being flowed through the vasculature. Gotcha. And then you get basically passive diffusion that like starts to take it out. But yeah, critically, we don't want to leave cryoprotectant behind and then warm the organ back up to 37 degrees Celsius. Because then we basically eat all of this toxicity that's going to be a result of like basically being warm and loaded with the cryoprotectant.
Yeah.
Similarly, on the nanoparticle side, I think a lot of work in the field has been focused on basically passivating the surface of the nanoparticles to make sure you're not leaving iron oxide behind in the kidney.
Um, you've mentioned a few times in the past about like you don't want your cryoprotectant agent to be too toxic. But why does toxicity actually matter if it's so cold that like no reactions are actually occurring?
Oh, interesting. Yeah. So the thing is that some reactions are occurring at 4.
Okay.
That's the trick.
Gotcha.
Yeah. It doesn't matter if it's toxic once you're down at minus 130.
Okay.
For sure. And there have been some strategies that have been brought up previously where you can actually have very toxic cryoprotective agents that can be loaded even colder. So like one example of this would be like the so-called M22, which is a formulation that must be loaded at minus 22 degrees. That's where it got its name. Very effective cryoprotectant, also very toxic.
What does toxicity usually what does toxicity usually manifest as?
Yeah, I mean, there's a variety of different, like when you say manifest as, it's like in cultured cell context or
In full organ context. I guess, has there ever been like a particularly toxic cryoprotectant used in organs?
I think that tends to not use like a really toxic cryoprotectant in whole organs. Obviously, like the outcomes here are going to be like different based on different organs. Yeah,
that makes sense. Moving like perhaps relatedly, there was this mouse kidney transplant thing that you discussed earlier. How did that go? Like when they everything was an autologous thing where they took the kidney out, they froze it, rewarmed it, put it back in. Was the mouse just perfectly fine? Or I think, was it a rabbit or mouse?
It was a rat.
Rat. Okay, rat. Okay. Like, did the rat live?
Yes. The rat in fact lived. Yeah. I mean, it was a cool study. They showed that you can actually like regain normal function in this kidney. I think that if you look at the sort of like recovery time, it took some time for the organ to recover. Like a matter of weeks for the organ to like fully recover normal function. But like they were able to like basically get a viable kidney through the cryopreservation and rewarming process.
Gotcha. And I remember you mentioned at some point that there was this concern of like immune, like epitope exposure as a result of the rewarming and the freezing and rewarming process. Would you be able to like walk through that again? Because I thought it was a very interesting anecdote.
Yeah, I think that anytime that you're going to induce like cell lysis in tissue, you can invoke an immune response. And so there's actually been some examples of this in like human pediatric cases where like basically you can take like some heart tissue out of a person, it can go back into the person afterwards. Obviously, there's no like self versus other response. But the strategy that you use for cryopreservation affects the outcomes of these like very tiny little tissue extracts and then reimplantations. And one hypothesis for the mechanism of action here is basically that because you get some cellular lysis during the cryopreservation process, you basically expose a bunch of the intracellular molecules that are then going to induce some basically like immune interaction and can cause actually rejection of the graft, even though it's an autologous transplant.
I imagine there haven't been so many cryopreservation transplant studies done such that like it's pretty clear like when this will happen and when it won't happen.
Yeah, I think that this is such a nascent field that I wouldn't say it. The thing that is not nascent basically is like embryo cryopreservation. There we're like really, I think we have many in on that process right now. I think it's this year there will be something like 150,000 live births this year in the US alone. They were previously vitrified as embryos, which is like a wild number to me. And like they can get stored for like 30 years. Oh, which is crazy to me.
Cryopreservation is a nascent field. It does seem like it's ramping up in recent years. And now that there's this probably like deluge of cryopreservation papers that are consistently popping up all the time, I'm curious, like, what is your own like filter when you're reading through these papers? Like what marks a paper as like particularly high quality and you pay attention to this versus something that you can probably just like skim and not like pay super close attention to?
Yeah, I think that there are, fortunately, like a whole host of groups that are doing things that would meet this bar. But I think that the bar that I'm particularly interested in for when you're doing things that are going to translate into an organ is sort of ask the question, are the assays that are done to demonstrate the viability of this organ in concert with what the field that they're trying to interact with has established? So for example, like if they're doing kidneys, are they doing standard assays that would be accepted in nephrology to evaluate the viability of this organ.
Mm-hmm.
And I think that if you go all the way down to like the molecular study, I think the molecular studies that I'm particularly interested in are ones that don't do sort of just like random scattershot screening, but instead like really get into like what's the mechanism of action of the interaction of this cryoprotectant with the water molecule. I think like water is like a underhyped molecule. It's actually incredibly subtle and complicated to interact with it. I'm biased, but it is currently becoming my favorite molecule. And I think that you can write really deep interrogations of the interactions of these cryoprotective agents with the water molecules. I think that those can be like deeply informative for like follow-on study.
And sorry, these are papers that are specifically trying to create new cryoprotectants, or even in the context of like no novel cryoprotectant work, you still want to know what the interaction of the cryoprotectant was.
I think I learned stuff even when people just like look at DMSO interacting with water. And people have done great things of like studying like the Raman spectroscopy of like water and DMSO interacting to try to figure out actual like coordinate, like how is this hydrogen bond actually like coordinating? I think that sometimes these things are like academic and can't be translated into better engineering. But I think oftentimes we can sort of lay better foundations for our mental models of coming up with like better cryoprotectants. And definitely we can come up with more interesting metrics we can be calculating in silico. Mm-hmm. I think that that's where a lot of these sort of like physical chemistry studies become really helpful, is it's like, oh, how can I think about basically simulating that? How can I think about driving this into a chip?
On the topic of in silico simulation, what is the, like, how much molecular dynamics, molecular simulation goes on internally at Until?
Yeah, I think we think a lot about how to do like in silico screening like well. And I think that there's a variety of different ways that you can do this. Like one that is like quite common is you can think about like molecular dynamic simulations, where you're trying to look at basically what is the extension rate of an ice nucleus that is like placed inside of some solutions. These are like so-called coexistence simulations. The way that you can think about this is basically just like set up a box. This box has hexagonal ice in one half of it, and the other half, it has some mixture of cryoprotectant and water. And you can look for basically like, does the ice tend to extend or does it tend to melt? Mm-hmm. This is a good way of measuring basically like the equilibrium between the liquid and solid state given some cryoprotectant mixture. And we found that like this is like somewhat interesting to look at for in terms of like ice formation.
I'm obviously not at all a molecular simulation expert. My interpretation was that phase changes, especially of water in molecular simulation, is like really gnarly and like not like very well modeled.
Yeah.
Does it like do you see that? And even if you do see that, you still think like these simulations are like pretty predictive of what happens in real life?
Yeah, I think one nice thing about trying to be an engineer here and not trying to be a scientist is that you just want to find things that correlate.
Okay.
And like we have the thing in the lab. It is true. The thing that you're getting at, which is a real problem for the field as a whole, is it's quite hard to simulate actual ice nucleation. So this is like a very the thing I just pitched you is like super contrived, right? I like literally just like set up a boundary of ice and I'm trying to look at the thing that is interacting with it. Mm-hmm. This obviously has like some deep limitations on this translation to the actual like test tube that I'm doing the experiment in. And it's because I haven't allowed for like nucleation has been taken completely out of the equation. Mm-hmm. And that's like kind of the whole thing that you're trying to get at, is how to suppress nucleation. Mm-hmm. The reason nucleation is hard to simulate is that it's too fast for us, but it's too slow for molecular dynamics. Because if your time steps are like 1 femtosecond and you need to simulate for like a nanosecond or something to be able to like see nucleation for every cryoprotectant that you want to interrogate, this is like not tractable.
Yeah.
So I think that it's a challenging thing to get around, is like, what is the right thing to simulate? And I think the things that our applied physics group spends a lot of time thinking about. It's like, what are the right things to simulate to be able to have some like basically predictive power around like, what is the efficacy of this cryoprotectant going to be?
How much do you personally, or perhaps anyone in the company, like pays attention to like the neural network potential research that's coming out?
Yeah, I think that this is actually really helpful. There's some versions of this that are more useful than others, as it would always be the case. Some of the neural network potentials are like still very like costly to be able to simulate compared to like classical force fields. And so I think you want to like pick and choose which ones you use and in what context you use them. It's like, I think there's no, at least for in our hands, there is no like skeleton key for like, oh, you do like this exact simulation and it works. I think it's more of like intelligent like ensemble of simulations to try to basically get some interpretation. But yeah, I think the work that's been coming out of like basically ML related, like ML related tools for better simulating like your interactions. It's like, I think it is going to affect cryopreservation just like it affects drug discovery. Like these are like, this is fundamentally improving our ability to model the physical world in silico. And I think that is great. And I would encourage those academics to continue to push hard.
Maybe a naive question. How much does like QM matter for these sorts of simulations, or like molecular mechanics is fine?
Yeah, I mean, I think that there's some things that you really care about quantum mechanics for, and this is where the neural network like based potentials can be like helpful, is like actual like hydrogen bonding of the stuff to water obviously involves things that are like not well simulated just with like a standard Leonard Jones potential.
Sure.
So there, I think that it is useful to think through like some more complex interactions than just like a two-term, like a simple like Leonard Jones system.
Okay, yeah, that makes sense. Moving on to like almost like non-scientific questions about until one immediate question I had upon like learning about you guys when you were like named Cradle was like, what are the economics of this setup? My mental model of organ transplantation is that there's like an organ waiting list. When your name gets called, you go and get your organ. There's no like direct to consumer setup. Like who are buying these organs?
Yeah, so the transplant pipeline is very complex, as I have been learning. And the thing is, there is no like direct to consumer. Like I can't call up and say like, hey, I need a kidney. That's not how this works. Like you were mentioning, there is a transplant list. There are the so-called organ procurement organizations who are responsible for basically like facilitating the transaction of like organ comes out of this patient comes out of this donor, goes into this recipient. And there are a host of companies that specifically handle like the logistics of like basically transporting the organ from one place to another viably. A really big player in this space would be like Transmedics, publicly traded company, who literally like they have a suite of private jets that will fly around and like pick up the organ from the donor and bring it back to the recipient. So this is all like, it's very, let's say like heavily coordinated, and the logistics are certainly not trivial.
When this is actually, we were just talking about this like before we started this conversation. I had this question about like right now putting an organ on ice is incredibly cheap. Perfusing with oxygen is incredibly cheap. What's a value proposition to go for something like Cradle Labs, Until Labs, much more expensive protocol? And you mentioned that like, there's this like, you'll need to rely on this like incredibly expensive transport chain as like heavily.
Yeah, I think that one of the nice things about doing something like organ vitrification is that because it takes urgency out of the process, it just like relaxes all of these logistical constraints. So for example, like I don't need to have a private jet to go get the organ anymore. I also don't need to wake up a transplant surgeon at 2 a.m. because that's when the organ became available.
No.
We now have in our vision a process that can be much more, let's say, like disciplined about bringing the organ from the donor to the recipient. And this has a bunch of knock-on effects. So like one, for example, is that it could increase like testing. So if you look at the outcomes for living versus dead donors for kidneys, you look at like 10-year graft survival rates. So the 10-year graft survival rate in the US for a kidney donor from a dead donor, for a kidney recipient from a dead donor, is around 50%. From a living donor, so this would be like you get it from your brother or something like this, it's about 60%. So literally just like the increase in basically like immune matching of getting it from a living donor, and it may also have some other logistical constraints there of like you can literally do it on the table that's next to the person.
Sure.
But there's like that much benefit to get just from basically like improved matching in the biological sense. If you look at the reference that I made previously about the fact that like in vitro fertilization like of embryos is now you have a higher chance of getting a live birth from a cryopreserved embryo than from basically a freshly implanted embryo. And the reason for this is, again, increased ability for testing. So we think of one, the cryopreservation process can lead to better outcomes for patients because we have this basically time that we have bought to be able to improve matching. We think that it can improve the like equality of organ allocation by allowing us to respect the transplant list more and have fewer sort of like open calls where the organ just needs to go to someone because we don't want it to get wasted. And then, no private jets required because we can get them there. No surgeons woken up in the middle of the night.
When it comes to like what the supply chain would look like if like Until Labs like ruled the entire system, how careful do you need to be with a vitrified organ? Like, can I put it in a truck and just like have the truck go, or does it need to be in a very specific, very special container?
So I think we would manufacture a container that was sufficient such that it could go on a truck. I think the things that are significant is you don't want thermal gradients to be able to come in. You don't want to obviously thermally cycle the organ ever up to above -130 degrees. There's some stuff around basically tight temperature control, but I think that these are all highly solvable problems.
Yeah.
And I think the marginal cost of doing this on a per organ basis is pretty trivial.
Yeah. And again, in this hypothetical of until labs are, until labs is everywhere. How much is the organ shortage problem solved overnight?
No.
Okay.
Unfortunately not. I wish that were the case. But in the end, this is still a supply limited market.
What gets better? Let's say 10% of people who need 10% of names are crossed off every year from the organ transplant list, and everyone else dies. What does that number rise up to, at least for kidneys?
Yeah, so I think that what's going to end up happening is you're going to have initially, let's say a few thousand organs, which would be the ones that are should be going into patients, would be viable, but basically get lost due to logistics. It's the organ is on the plane needs to get de-iced, the organ expires while it's on the plane.
Does that happen?
Yeah, Laura, my co-founder, was literally talking to a transplant surgeon the other day that was recounting this exact story. I'm not making this up whole cloth. This is an actual thing. And
this is not a particularly rare incident.
I think that this particular annoyance of plane de-icing maybe is rare, but I think that the idea, basically you can get a few thousand additional organs if you reduce logistical constraints. And these are publicly available figures.
Yeah.
The thing that is an interesting unlock in the long term is if you can start to relax the supply constraint. So things like being able to get organs that are from, there's a concept of DCD versus DBD donors. A DCD donor is death by, it's a cardiac event. These are more, let's say, challenging logistically to get out. The time constraints are tighter.
Just because ischemia happens immediately.
Exactly. It's a ischemia issue. The clock starts earlier. And so as a result, that is a sort of nascent field where people are trying to push into these DCD organs to try to increase organ availability. The other in the long term that I'm particularly excited about is xenotransplantation.
I was going to ask about that.
Yeah.
Sorry, go ahead.
No,
I would if we had sufficiently good xenotransplantation, do we need cryopreservation?
I think sufficiently good xenotransplantation mandates cryopreservation, but that's my perspective.
What's the rationale there?
So I want to envision a future for xeno that is maybe more aggressive than has previously been talked about. I want to envision a world where someone who has a heart attack and maybe would not even have time to be able to get a heart transplant can now get a heart transplant, where you go into an ER and there is a liquid nitrogen dewar sitting there that is filled with hearts that are ready to go. They can be transplanted in. Now, all of a sudden, organ donation is no longer something for chronic conditions. It is now something that is also for acute conditions. And that this is the thing that will dramatically increase the availability of organs, is basically if xenotransplantation could get solved. I think that there is some reasonable, let's say, skepticism about the timetable on which xenotransplantation will come online. But let's just say I'm cautiously optimistic that those guys will make progress. And I think that cryopreservation would be a natural fit for their logistics supply chain.
I think bringing in acute conditions onto the table is really fascinating. I had never really thought about it that way. What do you think of the xeno? I'm not super familiar with it. I just know there was that pig heart that was CRISPR to be a little bit more humanized. It was implanted into a human patient. The patient ended up dying, I think, but potentially for reasons unrelated to the heart.
Yep.
Do you think that field is going to rapidly mature over the next 5 years, or there's some big insurmountable problems there?
Yeah, I should clarify. I'm certainly not an expert on the process of that, the progress of that field. And I think that if you ask 5 people, you might get 6 opinions on the future of xeno. I've heard everything from it's right around the corner, to one transplant surgeon told me, xeno is the future of transplantation and it always will be.
It's like perpetually 5 years
Exactly.
away.
It's perpetually. Yeah, I think that was his perspective.
Okay.
So I think that there's a variety of perspectives on that one.
One thing I was really curious about, like this, like X number of people die per year because they are unable to receive that organ. How does X change if Until Labs like really succeeds? I'm not sure if you like the answer you gave was like, oh, like several thousand because we're still figuring things out. I'm not sure if you had like an exact, like there's been like almost models drawn up as to like how much can we like put a dent in the organ shortage crisis if this really takes off?
Yeah, this is like a really, unfortunately, it's a super complicated question to answer. And really a complicated, even more complicated question to answer well. And the reason for this is that the data here is just like, it's very challenging.
Yeah,
actually
I
to tease
imagine.
out like, what is the counterfactual of like the organ going into a person or not going into the person? So like, we have some statistics on like the expiry of organs during transit, which is where I got the like few thousand like organs metric. You can actually look at basically a pie slice of like what's the outcome of various organs, and like the ones that are basically like were viable but like expired in transit. Like if you add that pie slice with some other ones that are clearly logistically related, that's you arrive at like a few thousand organs a year.
Gotcha. And so like it's not necessarily the case that like we will like, let's say like Until succeeds, 10 years goes by, we'll have like a surplus of organs. Like every organ that's currently like in transport right now will be given to someone.
Yeah, I think that for the time being, this is still going to be a supply limited problem.
Gotcha. Okay.
So it will still be the case that there will be a waiting list. Unfortunately, it will still be the case that there will be people on dialysis in this country. I think that it will have to be cryo plus some other technology that will need to come online for that to not be the case anymore.
Yeah, that makes sense. How much do you envision the Until Labs protocol costing? Is it like an undecided figure, or
it's an undecided figure partially because we don't know what the Until Labs protocol will be.
That's fair.
I think it's like we have such a large suite of potential technologies that are brought to bear. But what I can say is that I don't see any obvious place where this is going to be like a gene therapy that costs like $1 million a patient. Like that's not what we're talking about here. And I think that the parts that are expensive are primarily the devices, which will be amortized over basically many, many organs. Right? Like these perfusion devices that we're talking about. You'll have a disposable component to it for sure, but that's not the expensive part. The expensive part is the part that's reusable.
When it comes to companies like Transmedics, who is like paying are they primarily contracting with insurance companies, and you are also planning on contracting with insurance companies? Like whose job is it to like ensure that almost there's there's like almost alignment between like what the patient wants and like the money that you expect to get from this?
Yeah, so I mean there are like Medicaid reimbursement rates that are set up for like organs basically. And so that there's a public payer, obviously, that's setting some like market baseline. And then there's like insurance basically companies that you have to be able to figure out what they're willing to compensate the transplant centers for. The customers that you're actually working with, though, these are like transplant directors, and you're going to be working with some OPOs. That's like the people who you'd be directly interacting with.
And what's the like approval process for this? Like, 'cause it's not a drug; it's almost like a procedure more than anything else.
Yeah,
is it a drug? Like, what is it classified as? Exactly?
Yeah, so I mean, we don't know yet, but I think that like medical device is probably how it will be classified.
How and I imagine there's like not that much precedent for something like cryopreservation, or was the ice stuff also like that had to go through its own approval process?
Yeah, I think there's basically going to be different approval processes for each of these. I think that there is some precedent if you look at things like hypothermic machine perfusion. I think that could reasonably set some precedent for the vitrification process, but again, we'll have to leave that to the FDA to decide.
Yeah, that makes sense. Moving on to the actual raising journey for Until Labs. What was the Series A again?
We did 58 million. Yeah.
Okay. Until Labs is a little bit of a strange thesis for a company. It's a biotech, but it's not a therapeutics company. It's serving transplantation, which I had not conceptualized as there could be a for-profit company really playing and doing innovative biomedical research here. And as far as I can tell, you guys are one of the very few people playing in that area. What was the fundraising journey like
Yes, I think that first of all, I would say that while it may appear that we are one of the few people working in the area, my guess is that that is not for
Okay.
long. And in terms of the fundraising journey, I think it actually started about a little over a year ago. Not where we were actively looking to raise. We had basically just completed our seed, and the neural slice paper came out right after we announced our seed.
Mhm.
Uh,
So what neural paper? Like the
the,
German
the
lab?
the one you don't know, the one you were referencing,
Gotcha. Like
where we
February.
did the rat cerebellum.
Yeah,
Like we
yeah.
basically that was we used that and basically announced the seed at the same time.
Gotcha. Okay.
And that was about 50 million for the seed. So yeah, about a little over a year ago, we had this idea that maybe we wanted to start playing around with this donor organ problem.
Mhm.
And like I said, there had already been like some of this work from the University of Minnesota, which we had been looking at. And I think it just became clear that this is going to be on the roadmap anyways. This is going to be on the scientific trajectory that we would want to be on, and we get to start helping patients.
Mhm.
So Isla, who's currently our director of preclinical research, came to me and actually like pitched this whole co-op, was basically saying like, look, we have this long-term roadmap. There's this obvious use case in getting this into patients. Like we should go after this seriously, and we should start scaling like right now to go into preclinical models. And so that kicked off this like journey where we started to initially just kick the tires on like, could we take our protocols and like sort of move it over? Could we take our engineering team and sort of task them off to this? And now this is like the dominant like focus of the company is like how to get this translated. One thing that we wanted to be able to do there is like basically raise to be able to accelerate that process of like getting this done and like towards the point of doing a first in human trial. And so I think that the primary like purpose of the raise is basically to bring on additional capital, to be able to parallelize a lot of these processes and like get things to market quicker. Yeah.
Was what was raising like how many questions did you get over like the economic thesis versus the scientific thesis versus some other thesis?
Yeah. I think that got questions along both axes.
Okay.
And I think that we are very fortunate to have excellent partners, excellent capital partners who I think understand the thesis really deeply. I think like actually in one of like the pre-conversations, you would ask me like what advice would like you give to people who are like similar positions. And I think I didn't give you a particularly satisfying answer because I don't think that I have one.
Okay.
And the reason for that is I think that we were really fortunate in that like the people who, so the raise was led by Founders Fund with Field Ventures and Lux joining. And basically all three of these groups are able to do like exceptionally detailed diligence on their own. Having like basically like technical conversations with their technical team was like you and I sitting here talking about science plus on like the level of depth that was required. But like there wasn't some like story that needed to be like packaged for them. It was just an actual conversation about like the technical risk.
So it wasn't necessarily that like, oh, like we want to do brain preservation and we're moving over to kidney preservation because like we're bringing in outside.
Yeah, no, that was, it was very much the reverse process there. It's like we went basically to go get more capital to accelerate being able to get the donor stuff to market.
What are common misconceptions that people have about the cryo field, especially people who are external to the field, and perhaps like not even laymen, but like people who you consider smart, and what are their misconceptions?
Yeah, I mean, I think that I had a misconception when I originally jumped into this, which was that it was like not doable because of ice, that you would always get ice that would form and irreversibly damage tissue. And in reality, you have this minimum temperature for ice formation at minus 130 degrees Celsius, where water turns to glass, not ice. So if you can traverse this danger zone between like 0 to minus 130, then the tissue will be safe and you can rewarm it without damage.
But you did mention about how like these cryoprotectants have existed since the 1950s. And so I imagine there should have been time for like the rest of the scientific field to be aware that like, oh, ice nucleation is a solvable problem. Why do you think there still is this misconception that like it's like fundamentally unsolvable?
I think that part of it probably has to do with the fact that like when we actually do cryopreservation of things like cultured cells in the lab every day, we use a completely different process that does allow ice to form that would not be compatible with tissue. So you imagine you take like some culture cells and you want to store those in like vapor phase storage. There you use a process called slow freezing, and you're allowing ice to form in the extracellular space, and it slowly expands and hyper concentrates the cryoprotectant elsewhere and then forms the glass. I think intuitively people understand like this should not work for tissue because you'll tear up the extracellular matrix. Yeah. So I think that probably has facilitated a misunderstanding of fundamentally how the cryopreservation process works when you want to go to these more like tissue specific or organ specific processes.
It sort of sounds like people don't actively think of the vascular system as a very good transportation medium. Is that fair to say?
Well, so I think that's also a common misconception. Okay. It's like, oh, if I need to like diffusively load this object, isn't going to take forever. Because they think about the equivalent of like, okay, I have like in vitro fertilization, I have a tiny little embryo that's like 6 cells that needs to go load a cryoprotectant. The people can envision in their head, okay, I like load the cryoprotectant, I cool really fast. That makes sense. And I think that like a key unlock is hijacking the vascular system for mass transport.
Why, like at the like very early beginning when like you and Laura first founded this company, was the plan like, oh, we're just gonna like push forward on this brain thing until it's done?
Yeah. So I mean, when Laura and I met, that's a funny story. So Laura and I met via her cold emailing me while I was a postdoc in Adam Cohen's lab at Harvard. And she hit me with like a very open-ended question, which was if I thought it was possible to reversibly pause biological function. And my initial response to her was the same response that any reasonable person has, which is basically, are you kidding me? Of course not.
No.
And there was like a couple of days after there was like something that was like eating at the back of me, which is like, I was a physicist by origin. And it's like, okay, if you have this kind of a response to someone who has this history, right? Like Laura had a very established history at that point of making like strong scientific bets.
Yeah.
It's okay, I should like be questioning my assumptions here. And so I went back and like looked at it and was like, oh, this problem is like fascinating. And I think that there's like real traction that's been made recently. And I have some ideas about how we might be able to continue to do that. And so initially it was very much like this like curiosity that drove me into wanting to like join up with Laura and get this going. And that curiosity sort of manifested in like a slowly expanding way where I realized the places that this could help. So as a bit of personal context, in 2016, my father-in-law, Mark, was diagnosed with a terminal case of cancer and was basically given a 6-month prognosis. And he lived almost exactly 6 months. And near the end of his life, a clinical trial for Keytruda came online for his disease, but he was too sick to qualify for it. And I think in these conversations with Laura, something that hit me was, this is a technology that could help people like Mark. People like Mark and their families who they don't need some like 100-year jump into the future. They need like 6 months.
Yeah.
They need like a year. And like this continued conversation with Laura led me to understand like, oh, like, wait, Mark's case is not like isolated. This is not some like exceptional thing. It is the case that like oncology drugs are forever getting better and survival rates are increasing. Things like pandemics, like think about this, okay? In the 10 years between the onset of the AIDS pandemic and the creation of combination antiretroviral therapies, 9.7 million people died. 10 years, 9.7 million people. And I think there was just like this overwhelming sense of like, there were no other things that I had touched before scientifically that had this kind of a lever arm on them to be able to affect this many people, just like buy time. It's like very skeleton key solution to healthcare. So yeah, I flew out to meet with Laura, NBC, flew back, quit my job, wrapped things up and like moved out. And I think initially we like really were committed and still remain very committed to this day to this hibernation as like the long-term goal. And this is like the idea of taking an entire patient who would be terminal with some disease and giving them access to cures that are right around the corner. Yeah, we started with sort of that in mind. And that was why the neural stuff was the first thing we wanted to do, because it's like the hypothesis is, oh, that's going to be the hardest thing. That's going to be the thing that for sure breaks. These are like insanely delicate tissues. Like in the lab, we would have challenges just like keeping them viable, like on their own, much less cryopreserved. So yeah, that's what we came out to originally do.
I think when prior to even like learning about Cradle existing, whenever I thought of cryopreservation, I kind of just assumed like, oh, that's like literally impossible to do. It's not, no one's ever going to crack the problem. Everyone working in it are grifters. Yeah, like I think when I read that progress report, like in preparation for this interview, I was like, oh my god, like that's like obviously like small scale, like how you scale it up, but still crazy achievement.
Yeah.
Um, one question I had was you've mentioned on over and over again about like how multidisciplinary cryopreservation is as a field. What expertise is hardest to recruit for?
Yeah, I think that again, you want top talent across everything. And so getting top talent in any field takes a disciplined approach. And I think that you want to show people that this is for real, and show them how they can contribute. I think the thing that practically is very hard to onboard is medical talent and expertise. I think that this is primarily driven by the like labor and economic incentives of being a doctor in the US. No one wants to stop doing their clinical practice, which means that it is really challenging to be able to get good medical talent to like basically come and like work on it. We've been very fortunate to recently have some awesome talent on, not necessarily even from MDs, but from like PhDs who've been working at Hopkins, for example. So like Dr. Amanda Lofton, who has recently joined us. She's a PhD at Hopkins who studied things like the perfusion of these like donor organs at hypothermic temperatures. So you can find it. It takes a disciplined approach. And you're definitely looking for personalities that have a high degree of, let's say, like openness to change.
How important is it that the people you recruit for these positions have like actual like have like spent several years in like an organ transplant clinic versus they have like done an MD and like know the biology?
Yeah, I mean, so I think that we tend to across the board recruit for people who like understand the platform, like understand the biology as a platform and not like very specific. So I think like hiring too specifically in a company like this is a deep mistake.
Really? Why is that?
And so I think that, for example, like you could go and say like, oh, we're just going to hire, let's like, if we shift over to like the molecular development side, you'd say like, oh, we're exclusively going to hire people who have like developed cryoprotectants before.
Yeah.
I think that it's reasonable to hire people who've developed cryoprotectants before, but I think that those are certainly not the only people who are capable of like contributing well to this problem.
Yeah.
And so I think like our approach on recruiting has been to go find not people who like specifically have thought about this problem, but have thought about like the facet of the problem that we need, maybe from a different lens. So like Andrew maybe is a great example of this. Very talented material physicist, but was previously thinking about like X-ray scattering. And
this is the Tesla guy?
This is, yeah, exactly. He was doing battery research previously. He's like, okay, you wouldn't naturally think like thinking about like lithium ions is very similar to like cryopreservation, but he's been a very effective leader for that group. And I think that is just like one of many examples of basically highly agentic people coming into our group and being able to make real progress against this problem.
I imagine the mental leap to like finding Andrew out in the wild, like working at Tesla and thinking like, oh, maybe he'd be really useful for a cryoprotectant group is a big jump. Like, did he reach out to you first? Did you reach out to him first?
Andrew and I go way back, so that was helpful. We used to race bicycles together, actually, when we were at Chicago. So that was helpful. And I think that, honestly, that was one of the benefits of having, like, come up through a scientific background that, like, put me in academia for a long time, is that I have the benefit of, like, knowing who is, like, very good from having, like, seen them work before. And Andrew always struck me as someone who was like both exceptional at physics, but also was like deeply operationally minded, like very like no BS, like problem solver. And it's like he was a natural like early hire for the company.
How much of your recruiting process is like reaching out to people who seem like hyper talented in this like orthogonal discipline to cryopreservation and saying like, hey, have you ever thought about working at Cradle or at Until, versus like them reaching out to you and saying like I want to like turn my talents into this field I know nothing about?
Yeah, I think that in the beginning it was almost all the former, right? Because we're in stealth mode and like no one knows who we are. I think that we are slowly seeing it shift to be the latter, where Laura and I are getting cold emails from some like thermodynamics expert who's like, "Hey, I saw this and it's just crazy. Can you tell me more about the glass transition in water?" And I think that that's part of like why I want to have conversations like this. This is part of why I think it's like my job to like go around and like talk about what we're working on,
Yeah.
is that I do think that there are like likely very many rather intelligent like physicists, biologists, chemists who would think this problem is interesting, but maybe don't see themselves being able to contribute to it meaningfully. And like, I think I would want to make the vociferous pitch that is not the case.
Okay, this is an open call to everyone watching this
Indeed.
to apply to Until. What like amongst like all the talented people who like end up in the recruitment pipeline for Until, what like is there like a particular personality archetype that you think is like most useful to have around?
Yeah, I think that like the first thing that I'm looking for is basically a highly agentic like personality. And what I mean by this is like a willingness to take on a high degree of responsibility for solving a really hard problem. That's one. The other that I always look for is basically people who understand failure deeply, because I think the one thing we pride ourselves on at Until is failing really fast. One of the things about building out a really wide tech platform, the way to do that effectively is like, if there's an idea that seems good, design the experiment that proves that's bad, and do that at a very high rate. And that I found that people who have like simultaneously a high degree of agency and a low enough ego to be able to like design something to prove themselves wrong, those are the people who end up actually being able to, I think, move really quickly and contribute really meaningfully to the problem.
You had like, I'm not sure if I'm hallucinating this, but I think you mentioned your postdoc advisor or your PhD advisor had this like one quote about like you should strive to like treat everything as the same field or something along those lines.
Oh, okay. Adam. Yeah. Okay. So I have like deep respect for like the people that I've gotten to work for. I actually started like my first research job was with an ultra fast optics a professor at the University of Chicago, Greg Engel. Greg was great and gave me a job when I like knew like less than nothing. Like, you're like an undergrad and you like think you know something, so you're actually less useful than like a completely naive human being. And then in grad school, I got to work for Mikhail Shapiro at Caltech, exceptional scientist, and like actually was the one that converted me from physics over to biology. And then my postdoc, I actually got like my dream postdoc, which was to go work for this guy named Adam Cohen. And Adam is both an exceptional physicist and a great like biologist and neuroscientist. And there's this like interdisciplinary way that his mind worked that just like had fascinated me. Like I've been following his publication history from like even before he was a professor. And I'm looking at this guy as someone who had like been able to like traverse these like discipline boundaries. And so when I showed up, I asked him, I was like, how do you do this? Like, how is it possible that you seem to be like actually pressing things all the way from like single molecule biophysics all the way up to like solving neural circuits to building like crazy microscopes? Like I was an optics, I thought of myself as an optics expert, and I'm looking at the microscopes that are in this guy's lab, and it's completely blowing me away. And the answer that he gave is like stuck with me like so deeply, which is that like nature does not care. Nature doesn't respect these boundaries. There is no such thing as like biology to nature or chemistry or physics. This is all just like fundamentally the same. Like at its core, and I think he and I share a physics background. So I think at its core, it's just physics at the core with like more scaffolding like built up around it. And I think that oftentimes when physicists say that, they're trying to give themselves like priority or something, but that's very much not how he meant it. What he meant was like these discipline boundaries are just like purely human imposed. That is like totally stuck with me. And like Adam's mentorship in particular is like incredibly helpful in like setting up for like what I'm doing now.
Do you think the only, like the primary way one can imbibe that mindset is just to simply learn about many different fields? Or I'm curious is like, if you were like mentoring someone, like how do you encourage them to think about the scientific process?
Yeah, I think that in terms of like learning many different fields, first of all, just like get comfortable with like being an idiot about like different disciplines, particularly early on, because like you have to be deeply, deeply comfortable with the idea that like if you're going to move through a discipline with which you are unfamiliar, like you will be a fish out of water in that space for a while. But I think that and this is one of the things that I particularly love about physics, is that it sets this like beautiful foundation through which you can attempt to apply like basically analogy to a whole host of different disciplines. And this isn't like always functional. Like this obviously breaks down in some like very complex systems. But it gives you a language for thinking about the physical world. But I've also seen people who are like very good biologists use their own version of like analogy to try to understand basically nature, and have similar conversations. Like Mandy, this person I was talking about, who does a bunch of these like organ perfusions for us.
Mhm.
Like she and I can have a conversation. And it's interesting because we will find a way to find like common language to describe something from completely different backgrounds.
Mhm.
So that's how I think about it.
And you've mentioned you've worked in a lot of different fields. I went through a Google Scholar and I saw papers on biophysics, neuroengineering, bioimaging, molecular engineering, and nanotechnology. Why, like you did mention like this like thing about your father and the field that like Laura pitched to you as especially interesting. But like I'm curious, like why start a cryonics company as opposed to like any other company?
Yes, I mean, like critically, the stuff that we do, we consider like slightly different than cryonics, which is a different process. But like, why start a cryopreservation company as opposed to any other company? I think that few things, as we've gone over previously, I think one of them comes down to impact.
Mhm.
Like I had actually not even thought about starting a company. I thought I was going to be an academic when Laura and I met. I was like basically looking forward to like starting my own lab, becoming a professor. I think that it was really a pull and not a push. Like I enjoyed doing academic research,
Mhm.
but there was this sense of like, oh, the scale at which we can have impact with this problem, the level of neglect that it has had in terms of like being able to like amass the amount of capital required to be able to like really go after it hard. Like these things were really, really contributing. And then there's this, and again, I sort of learned this next part from Adam. Adam always applies a 3-part test to figure out if you should work on something. So the first one is basically, do I find it like interesting? Do I think that it's something that like I like want to work on? Do I have the skills that are required to be able to execute it well?
Mhm.
And then the final one was the removal test. If you deleted me from the earth, is someone else likely to do it? And I sort of applied the same criteria here in my own way. And I think for me, it passed that sort of like 3-part test of like, should I sort of basically pivot into this? I don't think that I could have appreciated what it would look like when I did. I really was sort of like casting myself into an unknown.
Hmm.
But yeah, that was why.
One thing I perhaps should have asked earlier is like I kind of view like Until Labs as like existing as perhaps one of the like very few cryopreservation companies. Um, what does the landscape of like competitors look like? I like do you view like Transmedics like the current dominant organ supplier company as competition, or do you view the other cryopreservation companies as competition?
I mean, it's a great question. I think that in the end, there's going to be a marketplace for all of these technologies to sort of like coexist. And there will be a question of like which ones are used in what context. That's all going to come down to basically what are the relative viabilities of like all of these strategies.
Yeah.
But yeah, there's a whole host of companies that are coming up for doing like near sub-zero storage. These are storage at like -5.
Mhm.
There's like already established there's a lot of already established devices that do sort of like 0 degrees up, like 4 degrees, like hyperoxygenated machine perfusion at like cold temperatures. It's like very well established, all the way up to like normothermic machine perfusion. So this is like at 37 degrees actively perfusing the organ during transplant.
Mm.
These all have like different trade-offs. Some of them are organ-specific trade-offs. So yeah, it's hard to say yet who our competition is because it's hard to say yet who is going to be able to like basically press those viability metrics as high as possible.
If you view like the like perhaps what Until is working on is like you can store an organ infinitely,
Yeah.
like you can leave it for centuries and it'll come back just as fine.
Yeah.
And at the very top is like you like the organ needs to immediately go into your patient, otherwise it'll go ischemic and just
Yeah.
die. What does like the time look like for each? Like if like for putting an organ on like just like pure ice,
Yep.
how long does that organ last? Versus like if you go a little bit up or down the hierarchy, how long does it last?
Yeah, so it's obviously very organ dependent.
Okay.
And so for something like a kidneys are incredibly robust actually
Oh, cool.
to ischemia. So you can keep a kidney on ice for like 72 hours and still it will sort of like pink back up and like recover.
Mhm.
If you go for tissues like the lungs, that's the case. You have
Okay.
a few hours. to be able to get it transplanted because of really short ischemic windows. So it's going to be a very organ-specific question.
And even if you have this like hypothermic, like blood diffusion, it's still like max 72 hours.
Yeah, I'm not actually sure if there's an established machine for hypothermic machine perfusion of lungs. If there is, I'm not familiar with it.
Well, even for kidney.
Oh, for kidney, yeah, you're saying it's extending beyond 72 hours. I think, yeah. So I think that there's no, I think there's not a ton of research on like pressing kidneys out beyond like the 72 hours. There is, but like in terms of like sort of established places where people are really looking hard at perfusion, mostly actually liver is like something that's been like had quite a lot of perfusion work done for it. But all these things you're basically trying to press out those time windows to make it progressively longer. Yeah. In the end, if you get to vitrification, then that's just like you take time completely out of the equation.
Yeah. That makes sense. I'm curious, what we've worked in a lot of different fields. What would an alternative hunter have done if not for cryopreservation?
Yeah, it's a challenging question because it was like such a sliding doors moment for my life that sometimes it's hard to like look back and think about it. But I guess in like in a complementary world, like things that I was like interested in at the time that I was working with Adam, were mostly revolved around two questions. One was advanced sensing, and the other was neural computation. I think I was like drifting very much towards like advanced concepts of sensing. So something I did in my PhD was building out basically small scale devices to look at really tiny magnetic fields inside of cells, which was like mostly an academic study at the time that I did it. But I think that there are some interesting like downstream applications for being able to do something like MRI on a single cell to try to look at like diffusive transport of like tiny little molecules label free inside of a cell. I think that this is one of those things where it's like, it was beautiful and academic. And I think that the relative impact was like not quite as high as what I could be doing outside. I think it's a really natural fit, and I feel like really blessed to have had it like walk into my life.
Do you think if this like Until Labs opportunity did not pop up, you would have felt pretty content like not doing a ton of translation work throughout the rest of your career? Or you think, was there always something in the back of your head thinking like, I should like turn this into something that will reach a patient? Yeah,
I think that was like one of the things that was always challenging for me in academia, actually, was that there was always this like biting thing in me that was like a need for like a large impact. And I think like all of us want this, right? Sure, like all of us want to like make a large impact, and I'm not alone in like being an academic that's like, I wish that I could find some way of like translating this work. I also think that like a lot of academics do a really good job of eventually finding that in their career. But yeah, that opportunity was just like presented itself to me directly.
Yeah, so that makes sense. And I think that though, perhaps the last question I have is if someone handed to you $100 million equity free,
great,
you can spend it on Until, or you can spend it on some other scientific field that you were very interested in. Yeah. Where would you allocate the money?
I mean, right now, I'd allocate it directly into Until. And I'm not saying that as a cop-out. I actually think that, like, having seen like the interior of the organization, it's like, for me, this is the obvious place where we can make like rapid advancements for humanity. And yeah, that's where I would want to spend it. I think that in terms of like where we would allocate it inside of Until, I think basically parallelizing more to be able to go after like more kinds of organs and get these things to clinic faster. Cause like, I think there is some real urgency to try to like there are 100,000 people right now in this country waiting on organs on a waiting list. And I think that I have, like, my personality is very, I'll say I have a bias to urgency.
When it comes to actually like using the $100 million, what is the primary bottleneck that like the money will be used to help solve?
Yeah. So I think that the primary bottlenecks are a couple fold. One is in vivo experiments are hard. It's not even an in vivo experiment. Organ experiments are like complex, require lots of people, and are capital intensive. And to just do it, in the end, some of these things don't translate unless you basically scale up to there. Yeah. So it's like a deep focus on like basically that sort of like translational research. I also think that it allows us just like explore more of these like fundamental questions, work with academics to explore more of these fundamental questions, and build out the foundation that like actually predates Until substantially around some of these like more fundamental scientific questions, to try to figure out like basically what is the best avenue for us to like build off of as we go forward. Because I think that even the sort of like solution of doing this on like isolated organs does not solve the long-term problem.
Mhm.
I think that like the capital injection, I think, is like also quite helpful for helping us lay a foundation to be able to eventually do this on an entire organism.
Sure. Is the does it make sense to say that like the way that you've like explained this sounds like both sides of like you need like people to like figure out the theory for everything, and then you also need a small army of RAs to actually like do the experiment.
Yeah.
Would you like allocate the money equally, or you think like just like the empirical animal studies are like infinitely more valuable than like people theorizing?
I think that it's a weird cost equation because it's like I wouldn't say that one is like more valuable than the other, but like empirically one is much more expensive than the other.
Yeah,
and like it is simply the case that like doing like preclinical model experiments is like much more expensive.
Okay, cool. Hopefully someone gives you $100 million equity for.
I think we're pretty good at capital for a while. And thanks. I mean, if you're showing up with like equity free checks, I'll take them.
Okay. Thank you so much for coming onto the podcast, Hunter.
Thank you.
Okay. I think we're good.